And so in thinking about both of your talks, I guess the first question is for Dr. Shields. So it gets to the kind of the thought about kind of how complicated our treatments are becoming and how do we explain it to patients and also to other people who are part of members of the team. So tarlatamab is a therapy that it's given inpatient, at least for part of it, and is also kind of complicated. So I liked the glue that you had mentioned. How do you explain some of the side effects to patients in terms of what they might experience and also how to monitor for them when they go home? Because some of these things don't happen while you're in the hospital.
Yeah, no, thank you, Dr. Dagogo-Jack. This is a very important message to patients and their families. I think, definitely in our small cell smashers community, we are frequently seeing questions about tarlatamab, and rightfully so. It's a new drug. These BiTE therapies are new to small cell lung cancer. They're not new to the oncology community. We've seen them in a lot of heme or malignant heme, a lot of blood cancers like lymphomas and the sort and leukemias. But now it's really moving towards advanced solid malignancies like small cell. And so this is a new shift for our patients and honestly for a lot of thoracic oncologists like ourselves. And so explaining to patients that this is to be given, for the first two treatments in the hospital, to be able to have that potential opportunity to help support patients if something was to go awry early, just for the safety of the patient. It may be completely unnecessary. What we know is that about 55% of patients will have cytokine release, but to what degree? And so we know based on the study that most patients experience mild symptoms. What that looks like is maybe just a fever and a fast heart rate. We give fluids, we give Tylenol, patients feel better, and they get to go home. But there are small subsets of patients that this could be really severe and really scary. And so we need to be able to act on those quickly. We don't want them to be home if something happens. And so, my institution actually holds up to 48 hours just to be safe. I have had patients that have experienced cytokine release at 30 hours, 36 hours, 40 plus hours. And so it's important to stay within an hour of your hospital system. Ideally so that if there was something scary to happen and you're at home, you call the on-call doctor, you call the direct number to your clinic, you make sure you get a hold of someone in the clinic to let them know you're coming in and go into the ER so that can be managed quickly and appropriately, because sometimes this can escalate from 0 to 60 without warning. Most patients, I will express again, most patients have mild symptoms, but it's just those rare situations that we want to support patients. And so it may seem like overkill, and hopefully it is, but we just don't want to have any patients fall through the cracks. And so we really want to help support everybody in doing so. And I know that there was actually a study just at ESMO IO this week with Dr. Ann Chang presented a poster about the 6 to 8 hour observational study with the expansion cohort of tarlatamab. And if patients were able to stay close to the cancer center or the infusion center, that those patients actually didn't see a huge increase in safety signals as long as they were observed outpatient. And so I think more to come about who are these patients, what are the biomarkers that we have to say these are the patients who are going to have these happen, and that we can help let everybody else maintain a normal schedule and going home after an infusion instead of a hospitalization. But we're just not quite there yet. So we want to be safe and not sorry.
No, I completely agree. It doesn't always obey that like 24 to 48 hours, 24 to 28 hours, I guess, monitoring schedule. So I often do extended missions. And we have to think about our hospital system and also where the anxiety is related to being hospitalized, all sorts of things. So trying to do it safely, but also in a way that kind of respects people.